Live Fit Podcast, episode 123, Making Marijuana Mainstream with the Marijuana Doctor, Rachna, Patel.
It's been tremendous in changing the quality of my patients' lives, right? So a lot of these people, they come in and they're like, look, I used to live a very active lifestyle. I used to go for walks. I used to, play around with my grandkids. We'd play tag together. And ever since I've had this pain, it's put a stop to everything that I enjoy in my life. And once the pain is better managed and it's a medication where they're not experiencing side effects, and, they don't feel like they're constantly needing it, they can go back to doing all the things that they enjoy, especially exercise, because that in and of itself can help to reduce pain as well. Here's the thing. I honestly, truly feel like I've been in this long enough where medical marijuana has the potential to change the face of medicine. It's a true game changer. I think the thing that's holding it back right now is legislation.
Welcome to the Live Fit Podcast with Glenn Johnson, your resource for all things that contribute to good health. You will hear expert advice and interviews with leading authorities on fitness, food, fat loss, mindset, and the mind-body connection. You will find show notes, articles, and health programs at livefitpodcast.com.
Yes, it is time once again for the Live Fit Podcast. I'm your host, Glenn Johnson, your guide to better health. Thank you, everybody, for listening. And please remember, take a moment to rate, review, and subscribe to this program so you can be sure to catch the latest episode every time. Today's guest is Rachna Patel. She is also known as the Marijuana Doctor. Now, marijuana has been stigmatized for coming up on a century now, and despite the fact that no one has ever died from overdosing on it, and that people are dying every single day from opioid use, the stigma still persists. Also, the fact that marijuana has many benefits to the environment, to our commerce, and our quality of life, people still are not fully embracing it. But I think it's happening. Mainstream marijuana is building, the momentum is building, and we're soon going to see it all over the nation. Listen as Rachna Patel tells us how she treats patients all over the world from her office in California and how this ancient herb can help save us from the opioid epidemic and improve our lives. Hi, Rachna. How are you doing today?
I'm doing good.
Well, I'm really excited to have you on the show because I think marijuana is a really misunderstood, drug, I suppose. We can give it the general classification. I find a lot of people have a stigma towards it. They feel like it's the devil. They feel like it's going to corrupt them or it has corrupted others around them. So I find it interesting that here you are advertising that you prescribe this. And before we get into more of those details, please give us a little bit of your background, how you got to do what you're doing now.
So it all started with an ad on Craigslist, believe it or not. So, yeah. So basically, this was during residency. I was training in the area of emergency medicine. And just to give you a little bit of background, my desire to become a doctor stemmed from the fact that I was looking to really, truly impact change in people's lives. But in reality, what I saw was that on the one hand, I was handing out prescription medications. And on the other hand, these patients were coming back experiencing side effects from these prescription medications. They were coming in addicted to these prescription medications. Mm-hmm. And then I was in the unfortunate position of having to resuscitate overdoses, from these prescription medications. So, and those were actually, in fact, the most common overdoses that we saw in the emergency room. So when I saw this ad, and the ad said, medical marijuana doctor needed, it definitely piqued my curiosity. Because the one thing that sat heavy with me was that I'm not really solving a problem. In fact, I felt like I was creating problems. So when I spent about a good year digging through the research, and what I found most compelling was medical marijuana's potential to treat chronic pain. And so a year later, I was like, okay, I know what's in the books, but how does it play out in reality, in the clinic?
Exactly.
So that's when I decided to work at a medical marijuana clinic. And then eventually I started my own practice. And here we are today, over 5 years later.
Tell me more. I'm fascinated by its potential to treat pain, chronic pain. I don't know if acute pain is in there too. I've been seeing billboards around town that says states that legalize marijuana have 25% less opioid abuse or overdose, or however it was worded. Do you find that valid?
Yes, because here are the results that I'm seeing in my patients. I have patients that come in having years and years of chronic pain. And a lot of times, the most commonly prescribed medications for chronic pain are opioids. Okay. Mm-hmm. But what ends up happening is that these patients, like I said, they experience side effects. They're concerned about getting addicted to them. And clinically, what I see is that patients are able to, typically, most of the cases, one of two things happen. They're either able to significantly reduce the doses of these opioids, or they're able to eliminate them completely. So there's a lot of validity to what you've seen on that billboard.
I've had a strong opinion against opioids for a long time because as a health coach and somebody in the health and fitness industry, I've come across people who've confessed to me that they have accidentally picked up opioid addictions. They had an injury, an accident, a surgery, whatever it was, and they started taking these pills because that's what their doctor gave them and told them to take. And you're not supposed to chase the pain, you're supposed to lead it. So if that's the case, you never stop. And some of these people were very upstanding citizens in our community. They had great jobs. Some were business owners. They were not at all what you would think of as a junkie or an addict, and not even to the point of like an alcoholic where they had some visible effects, but just the fact that they couldn't stop taking these. They were legitimately physically addicted to them. I've also met people who've had family members die from accidental opioid overdose. So it's something that I've been really interested in, and it's, I'm looking for a better solution. And it sounds like you might have it.
Yeah, I think medical marijuana is a great alternative for a couple of reasons. Okay, so one, when it comes to side effects, so when taken, this is all in the context of taking it appropriately. When you take it appropriately, it has far fewer side effects than opioids. When it comes to addiction potential, it's far less than opioids. There's still a potential there. So let me just make that clear. Mm-hmm. But let's put that into context. Now, compared to opioids, opioids have an addiction potential in heavy users, it's about 20 to 30% chance of addiction. Mm-hmm. In heavy users of marijuana, it's about 9% chance of addiction. Okay. Oh, wow. Now, here's the other thing when it comes to addiction. One is how you use it, right? So I always like to equate it to alcohol. Having a glass of wine a night versus having a case of beer. You're more likely to get addicted to that case of beer night versus that glass of wine.
Sure.
But the other thing is that interestingly enough, marijuana is fat soluble. So you don't have to take it on an everyday basis. In fact, I have patients that use it, maybe a handful of times a month. And that's sufficient. Okay. Huh. for the remainder of the days that they're not using it. So that's one thing. And then the other thing is when it comes to withdrawal, with opioids, the withdrawal tends to be pretty severe and gnarly. You can, one of the worst things that can happen is that you sweat profusely.
Wow.
And you can get diarrhea from it as well. With marijuana, the withdrawal symptoms typically last, I'd say, anywhere from, and again, this isn't heavy users, 4 to 6 weeks. And it's typically changes in appetite, changes in slight irritability, but that's pretty much about it. Now, the most important thing is that an overdose on marijuana is not lethal. So if you look at it in comparison to opioids, it's a far better option. Mm-hmm. The other thing is that it's been tremendous in changing the quality of my patients' lives, right? So a lot of these people, they come in and they're like, look, I used to live a very active lifestyle. I used to go for walks. I used to, play around with my grandkids. We'd play tag together. And ever since I've had this pain, it's put a stop to everything that I enjoy in my life. And so once the pain is better managed, and it's a medication where they're not experiencing side effects, and they don't feel like they're constantly needing it. they can go back to doing all the things that they enjoy, especially exercise, because that in and of itself can help to reduce pain as well.
Mm-hmm.
So it has tremendous effects. And then I've had patients, where they'll come back to me and say, doc, I just want to let you know that I've reduced the use of this to the point where I hardly need it. I use it maybe, once every couple months, and that's about it.
So they're learning how to deal with the pain as well.
Yeah. With an improvement in mood, with the ability to go back to your activities of daily living, it can create a huge lifestyle shift. In fact, I've had patients come in saying that they've managed to lose a good number of weight because it's not from the marijuana itself, but because they're going back to living their quote unquote normal life.
Now, I'm a technically minded person. I'm familiar with how opioids and aspirin and some of the other pain relievers work. How does marijuana work to relieve pain?
Sure. So we have a system in the body called the endocannabinoid system, right? So there's actually receptors in our body for the chemicals in marijuana. And the reason we developed these receptors in the first place is because we have chemicals just like the chemicals in the marijuana plant that our own body makes.
Right.
And that's why we react to the chemicals in the plant. So there's a couple different things that this whole system does. One is that it helps to reduce inflammation. So it works on the autoimmune system and reduces inflammation. Second is that it modulates pain along the pain pathways, right? So what the heck does that mean? Basically, it dampens the signals that go to the brain when you're experiencing pain. So basically, your brain is telling you, yeah, you have pain, but it's not bothering you as much. And other times, patients will tell me that the marijuana helps me to get my mind off of the pain.
Mm.
Then the third way is that there's a physical. So there's two aspects of pain: a physical aspect and an emotional aspect. Okay.
Mm-hmm.
So basically, it's like your brain telling you, okay, this hurts. But then there's another part of your brain saying, this doesn't feel good. It feels bad. Okay. So it's almost like, it's a way for your brain to motivate you to do something to help get rid of the pain. So again, the marijuana dampens the signaling between the physical aspect of pain and the emotional processing of pain. So again, I have patients telling me that the pain doesn't bother me as much, and that it helps to get my mind off of the pain.
That's fascinating. Previously, I've heard it used for cancer patients. How is it used in a similar way? Is it just for pain and anti-inflammation, or are there other properties that help with, fighting cancer or just making life more comfortable during treatments?
So a couple different things. So one is that it helps anybody that's undergoing chemo tends to experience a lot of nausea, a lot of vomiting, a lot of lack of appetite, right? So that's one aspect that it helps with. It helps to stimulate appetite, helps to reduce nausea, helps to reduce vomiting. Okay. Then long-term effect of chemo often is residual pain, nerve-related pain, neuropathy. Okay. So that's another aspect that it helps with. Now, the whole marijuana treating cancer is incredibly controversial. There are claims being made that, it treats or cures cancer. As a physician, having looked into the research, having treated patients, I would never make that claim. Reason being, the research that we have is in animal models, okay, mainly mice and rats, and in petri dishes, okay?
No.
We have very, very, very little information in humans, right? So you can't take something that holds to be true in rats and then just translate it over to humans. It may not hold to be true. Clinically, I haven't had patients come back reporting to me that it's treated their cancer, it's cured their cancer. And, the important thing to note is that, yes, there's a lot of stories out there that you'll find on the internet, but that's one story in how many? Okay, because there's success cases and then there's failure cases, right? So that's how we look at data.
Mm-hmm.
Is it 1 in 10 cases that are a success, or is it 1 in 10 million cases that are a success, right? So that, what's the success rate?
Right.
So that's important. And then just this whole term, treat and cure cancer, even an oncologist never says that, we've treated your cancer, we've cured your cancer. Because you just don't know, right?
Mm-hmm.
They'll say that the cancer is in remission, but there's always a chance that it can recur.
Right.
So I think that's a claim that's being made that's not well justified.
Yeah, I take everything I see, especially on the internet and Facebook, et cetera, very lightly, if even that much.
Yeah.
And since I'd never heard that in any of my academic books, I thought maybe there definitely may be some holes in that story. But then again, this is also something that has been stigmatized and taboo. It's taboo subject very often. You rarely read anything academic about it, research about it. So how do you deal with this stigma? I mean, I talked to somebody yesterday who told me she's 65 and she feels good and she's trying to improve her health, but she said, if I get cancer, I'm smoking pot. I don't care what my family says.
Yeah. Okay. So how do I deal with the stigma and the taboo?
Yeah.
It's through education, right? So that's why I'm sort of championing my efforts to educate through my YouTube channel. I've basically leveraged the internet to educate, so I have a very active YouTube channel. I'm constantly putting out information, and I always put it out from two perspectives. One is from the aspect of what the research says, and the second is what I've seen clinically as well. And then I also, I don't always have all the answers, whether it's legal issues about marijuana or other areas of medicine that are not my expertise. So in that case, I will bring on others that know in depth about that subject and to speak about that subject. So I think it's a lot of education. Same thing when it comes to alleviating concerns that patients come in with, about addiction, about, getting the munchies, things like that. I think it's mainly just educating them.
And reflecting on your legal comment, do you want to tell me where you're located?
Yeah, so I'm in California. And in a couple weeks, marijuana is about to be legalized for recreational use here.
Oh, no kidding.
Yeah. So essentially it's January 1st, 2018, although it's going to be a rollout process. It's not going to all happen overnight on December 31st. But I think the state's kind of scrambling at this point to get things together. So basically, essentially what that means is that anyone over the age of 21 can just walk into a medical marijuana dispensary and purchase marijuana products.
And medical marijuana with a card has been legal in California for how long?
1996.
No kidding. That's
a
long time.
It's the very first state to legalize marijuana for medical use in the United States.
Huh. I had no idea. How do you feel about recreational use?
So I have a double-fold opinion on this, right? So on the one hand, there are people out there that struggle with chronic pain, that struggle with anxiety, that struggle with insomnia, that are hesitant about using medical marijuana because currently, right, the way medical marijuana works in California is that you have to go see a doctor. The doctor evaluates you. And then based on that evaluation, the doctor then, deems it fit or not, that you'll benefit from medical marijuana. So there's a lot of paperwork involved. And from a legal aspect, though everything is protected by what's called HIPAA, health information is protected through patient-physician confidentiality, people still worry that, I have now left a paper trail that I use medical marijuana.
Right.
So, when a dispensary opens up for recreational use, they can just walk in without leaving a paper trail. Okay, so
Ah.
on the one hand, it opens up the option for a lot of people. Now, on the other hand, there are people, so it's very easy to overdo marijuana and experience side effects from it, right? The worst case scenario side effects are visual and auditory hallucinations, nausea and vomiting. And if any of your listeners have used marijuana back in high school and college, they've probably experienced this because most of the time when people use marijuana, they typically tend to overdo it. And what they're experiencing are the side effects. So, there are parameters within which you need to use it, which most people aren't aware of how to do so. So that's one thing. Now, the other thing is that there are populations of people that need to be very wary about using marijuana because it can exacerbate their underlying medical conditions. Let me give you some examples.
Please.
Anybody who has any sort of lung conditions, right? So any form of inhalation can exacerbate this lung condition. Anybody who has a heart condition, consuming excess amounts of marijuana can increase your heart rate and then exacerbate your underlying heart condition. Let me give you the example of someone who's recently had a heart attack. It takes the heart a couple months, like 6 to 9 months to recover. It's almost like getting a cigarette burn to your skin.
Oh, wow.
You can see the progress of that burn, how long it takes for it to just go back to looking like it did when you didn't have the burn. That's how long it takes. So, any undue demand on the heart can further exacerbate problems. Then there are people who've had a history of psychotic episodes. So I mentioned visual and auditory hallucinations. That's a big component of psychotic episodes. So if you take a substance that causes these, it could throw you into a psychotic episode. So these are just some examples where, it has to be used with caution. So it's I don't know, the way the system is sort of evolving, it's a good thing, but from a physician's perspective, it can also be a bad thing too.
Yeah, I've been curious about that since I've heard of the states that had medical and then went to recreational, and thank you for clarifying that. It's kind of a two-sided incident.
Mm-hmm.
It's not as cut and dry as legalizing opioids, for example.
Yeah,
and
right.
you have people self-prescribing, or maybe they'll see you and learn about it and figure out a dosage and whatnot. So how do you determine a dosage for somebody? I don't know, pick a chronic pain issue that maybe you have had frequent or recently. What would you instruct the person for their prescription?
Yeah, so it varies. So when it comes to marijuana, dosing varies highly from patient to patient. There are patients that need high doses and there's patients that need very, very low doses. And it's basically a titration process that I walk my patients through so that they can determine what dose is right for them. Now it's not just dosing that matters when it comes to marijuana, but what else is important are the amounts of CBD and THC as well. The cannabinoids in marijuana. This is what these chemicals are called.
Mm-hmm.
Because varying amounts can have a different effect on a condition. Okay. And plants naturally make different amounts of these chemicals depending on their genetics and also depending on the environment in which they were grown. But, nowadays there's a lot of breeding going on as well. So plants can be bred to create specific amounts of chemicals. And so there's a wide range of chemicals in different products that are available. Just to give you an example, you can purchase bud, marijuana flowers that are 2.5%. They have a potency of 2.5% THC,
Mm-hmm.
but then you can purchase concentrates where the potency of THC goes up to 70 to 90%. That's a huge difference, right?
Wow.
So some people need higher potencies, some people need lower potencies. So it's just going to depend on the medical condition, on the severity of the condition, all of those factors combined.
So it's not as simple as taking a pill and, that was a little too much, break it in half and take half of it.
No, not always. There's other nuances to it.
Yeah. So what about getting high? I mean, what if somebody doesn't want to walk around stoned all day?
That's okay. So basic concept. Let me explain this basic concept to you. Every medication, including marijuana, has a dosing range, right?
Mm-hmm.
So there's a subtherapeutic range where what you're taking is too little. It's not having any effect. There's a toxic range where what you're taking is too much and you're getting you're getting side effects from it. And then there's that therapeutic window. Okay, that's a sweet spot where you're getting medical benefits, but you're not getting side effects from it. Okay, that's what I'm working on patients to achieve, is that therapeutic window. So I give them parameters within which to use medical marijuana so that they're falling into this therapeutic dosing range.
Now, what I found interesting is that you said some people take it a couple times a month, and that lasts them because it's fat soluble, so it lasts them for the 2 weeks in between or so.
Yeah, it's like vitamin D.
That is fascinating.
Yeah. That's probably one of the most amazing things about it, because most other medications are water soluble. Okay, so that flushes out of your system much quicker than a fat soluble substance. Now, the bad side of it is that when it comes to drug testing, it can be detected, 30 to 45 days out, sometimes even more, depending on how much you hold on to fat.
Does it matter on the person's body fat ratio or what they eat?
I don't have research to back that up. Here's some observations. I have noticed that my athletes, these are athletes that are like biking 60 miles in a day. Okay. Mm-hmm. Which in California there are a lot of. They tend to need to use more frequently than the average person. But I imagine they're lean, their body fat percentage is probably very, very low. And also they have a high turnover of their fat cells too, I imagine. So that is an interesting observation when you apply the science to it.
So I back on episode 55, I spoke with a gentleman who sells hemp oil for high CBD, and he says there's 0 THC in there, and he told me that the patients don't get high. And he's not a doctor. It's not necessary to sell the CBD, as I understand it. What sort of efficacy do you find in CBD alone? Is there anything to that, or is that all a bunch of malarkey?
Okay, so I have an excellent video on this topic that your listeners may want to watch. It's called How to Buy CBD Oil, and it goes through all sorts of nuances. But let me give you sort of a brief summary. Basically, the difference between hemp and cannabis. Cannabis is also referred to as marijuana, same thing. The main difference is a legal distinction. It's basically the same plant, but by legal standpoint, hemp has less than 0.3% THC, and by default, marijuana or cannabis has more than 3% THC. Okay? Mm-hmm. So that's one aspect of it. But the other aspect of it is that if you look at potency, there's you can get products at dispensaries that are of much higher potency, right? Greater percentages of CBD at dispensaries than you can in hemp products, and that can make a difference for a lot of patients. The other thing is dosing. Those tend to be much smaller doses. When the preparations tend to be of smaller doses compared to what can be found at dispensaries. Okay. Now, the other thing is, this is sort of from a standpoint of lack of regulation. So because there's a lack of regulation, with hemp products sold through websites, you don't really know what you're getting unless, you can sort of get a third party lab to verify what's actually in the bottle. Whereas, at dispensaries in states that have legalized for recreational use, laboratory testing is mandated by the state. And there are protocols and standards that are in place that both the labs and the dispensaries have to abide by. So, it ultimately comes down to trusting the product.
As far as recreational go, you said that the person has to be 21 years or older. Now, with medical marijuana, with a prescription, is there an age minimum?
No, there isn't. And I've treated patients that are fairly young, mainly with epilepsy that have been young as like 6 to 10-year-old. But again, in children, you want to use with great caution. There have been cases in Colorado where from accidental overdose, these children end up in a comatose state in the emergency room, right? So you may have parents out there that are looking to treat their child's seizures. And they're sort of, again, self-medicating. And in the process, they could end up giving too much and do harm in the process.
So this comatose state you just mentioned, what can be done for that? Is there permanent damage? How long would it last? Do you need to go to the emergency room?
Yeah, I mean, if there's any sort of loss of consciousness, definitely go to the emergency room. So the case studies that I read up were written by emergency medicine doctors. Typically, I didn't see any long-term follow-up on these studies. So it was just a report of, hey, this is what we found in the emergency room of a child that accidentally consumed too much marijuana. So I don't have an answer to your question about, what happened to these children long-term.
Is there any danger during the growth phase of this human from using the marijuana over time? Let's say they have epilepsy and that's what keeps it at bay. If they were to use it from, I don't know, age 6 to, beyond 20?
Yeah. So most of the research that's been done has been done in heavy users of marijuana, right? So that skews the data in one direction. Now, there's a few studies that have been done on basically medical users. Okay. So and in two respects, actually a couple different aspects that I can talk about. One is where they looked at the brain at the macro level. Okay. And these were teenagers. These weren't kids that were younger than in their teens. They looked at the shape and the size of the brain, and these were teenagers that had been using for at least 3 months on an almost a daily basis, and they found no difference in from before and after in the shape and the size of their brain. That's one aspect. Now, at the level of cognition. Okay, so cognition is important in everyday functioning. Cognition includes things like planning, preparing, remembering, both long-term and short-term, executing different things. So important to basically surviving in today's world. So interestingly enough, this is a small-scale study that was done at Harvard, and what they found was they basically had these folks use marijuana on a regular basis, and they were using it on an average 5 of 7 days during the week, and I think it was for a period of 3 months at least. And they ran a battery of tests. They had them sit through different tests, right? So one example of one of these tests is there were 3 parts to it. In the first part, you were given a row of X's on a piece of paper, and they were in different colors. And basically, all you had to do was just let the tester know what color the X's were printed in. Okay, simple enough. Second part of the test was you were given a piece of paper and had a bunch of words printed on it, and the words were names of colors. It was all printed in black and white. So you just had to read off the words of the names of these colors down one row after the other. Again, simple enough. Third part of the test, you were given a bunch of different words. They were names of colors, but they were printed in different colors. Okay, now the tricky part was, say you saw the word red. Red was not printed in red. Red was printed in blue, green, and yellow. So what you had to do was tell the tester what color is the word printed in. Right? So that makes it a little bit difficult because a lot of times you could accidentally just read the word instead of telling the tester what color it's in. So it adds an element of complexity. Now, the hypothesis typically would be that, okay, the people who use marijuana on a regular basis, I imagine that they would be slower in completing the test, and they would be less accurate in completing the test. But in fact, what happened was that they were much more quicker at completing the test, and this was not by sacrificing accuracy. So they were just as accurate but quicker.
No kidding.
So that's another interesting study, and it's a small scale study though. They're working on getting more and more people, more participants in the study, and expanding the study. So it's basically a pilot study.
Mm-hmm.
And then a third scenario was where they looked at people who use marijuana long term and what sort of effect it had on things like cholesterol, blood glucose levels, their waist circumference. And really, they found nothing, between the sort of group that didn't use marijuana and the group that did use marijuana. So that's sort of the research that I've come across so far. But like I said, a lot of the research that's done is in heavy users when it comes to long-term use. So it has a bias to it.
Right, right. Well, that's very interesting. That doesn't really go with the stigma of marijuana users being slower and dumber and less enthusiastic for life and accomplishment.
Yeah. Now, here's the other interesting thing. The studies that have been published have been conducted by NIDA. NIDA is the National Institute of Drug Abuse. So they're already studying marijuana as a drug of abuse, as opposed to a medicine, right?
Huh.
So that's what they're looking for. Is okay, so it's sort of like if you put it into context, it's like, all right. But it needs to now be sort of shifted and put into a different context.
Yeah, that's fascinating. You were talking about that test for cognition, the colors and the words. I have an app on my phone for brain exercises called Brain Games or something like that, and it has the exact same thing. So I'm familiar with that.
Yeah. Mm-hmm. And they ran them through a battery of other tests too, and all of them were tricky in one way or another.
So you mentioned earlier that somebody with lung conditions should not smoke marijuana. Are there other ways to ingest it that has medical value? I know I've heard of the magic brownies and that sort of thing. Is that a legitimate way to treat medical conditions?
So the industry's evolved to the point where it goes way beyond the stereotypical brownie at this point. So there are edibles. You'll still find a lot of times brownies on the market. But in addition to that, a lot of times, most commonly what you'll find in terms of edibles are chocolates and gummies. But you'll also have what are called tinctures, which are drops that you put under the tongue. There's also topical formulations of marijuana. Basically, it's an ointment that contains the chemicals extracted in it that you can apply to the affected area. And then there's also rectal and vaginal formulations of marijuana as well. And then
really?
And then as an alternative to smoking, there's another form of inhalation known as vaporization. So basically, the basic concept behind vaporization is that it's heating the plant rather than burning it. So you're avoiding the process of combustion, right? And that it's the combustion process that creates pollution. Kind of the same thing that goes on in your car. When you combust gasoline, it creates hydrocarbons that are damaging to the lungs.
So if our cars used vaporizers instead of gasoline ignition engines, our air would be cleaner.
Yeah, I think they tried that, and it didn't work.
I figured. So back to these different ways of getting the marijuana in the body, is there a difference as far as the efficacy?
Not a difference in terms of efficacy, but a difference when it comes to the type of medical condition that you're treating, right? Just to give you an example, if you're having nerve-related pain, like in your back, typically like a topical is not going to cut it, right?
Right.
Because it's too deep rooted. So
okay.
So in that sense, it's going to depend on the medical condition that you're treating.
What would a topical be good for? A muscle
issue
or skin?
So muscular conditions, bone-related conditions, skin-related conditions. So bone-related conditions in that, okay, so it depends like where the bone is, okay? If it's like a hip bone, then topicals are not going to work well for it. But if it's bones in your like hands or feet, then yeah, topicals will work well for it.
Okay, so the bone that's close to the surface of the skin.
Yeah.
Okay.
Yeah.
And rectal, that's interesting. Is that
Rectal, yeah.
would
So
that be the same as
typically,
ingesting it, like the the brownie or the gummy or something?
yeah, so you have rectal absorption of medications, right? Typically, it's used as a last resort when other methods of administration just aren't working, right? So, as an example, this isn't related to marijuana, but typically, like, say a child comes in seizing and you can't give them anything orally because they're seizing, you can't get an IV in, so that's when you would resort to using rectal.
That makes sense.
So yeah, so it's just going to depend. I don't recommend it that often. In very rare cases, I recommend it.
Now, do you see people in person only, or are you able legally to treat people remotely?
Yeah, so what I'm doing is I've been getting phone calls from people all over the world. So what I'm working on as we speak, and this will be done by the end of January, is creating protocols by medical condition and included as a part of the protocol. So basically, the protocols are a video recorded protocol walking people through exactly how to safely use medical marijuana, right? So there's videos that go into dosing, there's videos that go into, what combination of cannabinoids will work the best. There's videos that go into how to avoid side effects. And then it includes a consultation in it as well. So I'm not working in the capacity of being the patient's physician, but it's more in the capacity of being a consultant on the topic.
Okay, so it's still telemedicine.
Yeah, it's similar to that. Yeah, so I will be meeting with people through a video call online.
That's fascinating. And they would have to be in a state that has it legalized?
They would have to be
That's up to them?
in a state. It's up to them, right? Because I'm providing the information, but it would behoove them to be in a state where it's legalized, where they have access to products that are laboratory tested, because that's mainly what I focus on.
That makes sense. Well, Rachna, this is fascinating stuff. I really can't wait to see more as time goes on with more research and see where this whole opioid epidemic goes. And, I imagine that'll be good for business, but I guess time will tell.
Yeah, time will tell. But here's the thing. I honestly, truly feel like I've been in this long enough where medical marijuana has the potential to change the face of medicine. It's a true game changer. I think the thing that's holding it back right now is legislation.
And, the thing that I keep going back to with most of this stuff, with pretty much everybody I talk to, is humans are always trying to outsmart Mother Nature, but we keep going back to Mother Nature was right all along.
Yeah, I agree.
All right, Rachna, it's been a pleasure. I wish you the best and have a fantastic day.
You too.
Thank you for listening to this episode of the Live Fit Podcast. Please subscribe and share with someone you care about. Read show notes, articles, resources, and learn more about our weight management programs at livefitpodcast.com.